in their responses? And then I'll let you answer that first.
I'm going to pivot to Maria for that. Did we break it down by that? Do we have the ability to?
We have that data.
Yeah.
Yes.
Okay. Some of this, we have probably years worth of data that we're going to be digging through. So that's a good one for us to add to our list to look into.
My other question is, thank you. My other question is, have we seen any improvements in like the frequency the patients say that their physician talked to them about the cost of care? Or have any of these numbers gone up or down in the right way in the last 5 years?
No. They've remained about the same, and some of them have increased.
So just to piggyback on your question, I think one of the findings for us, and we don't want to compare the previous data set from 2014 to the data set we have today, but one of the interesting findings was that despite the fact that the conversation around cost has continued to accelerate, and we as a community I think have done a really nice job to try to teach patients how to engage in that cost, the number that you saw, there are fewer patients having cost conversations today than did when we asked that essentially the same question in 2014. So fewer conversations are being had, despite the fact that we've all tried to really raise the importance of having them.
Could it be that they're going to more organizations like yours and having those conversations versus with?
Well, I'll refer you back to the data on the slide, right? Which is, it's not being raised, right? So the conversations aren't being had, and it's work that we have to do. It's an opportunity.
Yep.
Hi, Kathleen. I'm from Patient Advocate Foundation, and so we provide a lot of direct service to clients, and I know when they call us, often they don't understand their health insurance. So what is a copay versus deductible versus all the other components? Did you ask any questions in your survey if they understood what those various items are? And if you did, will you be providing those results? And if you didn't, are there any plans to do some sort of educational campaign around understanding? Because I know that's one of the challenges that we're trying to formulate, like how do we help our clients understand those components? Because as VJ mentioned, people don't often understand how to best utilize their existing insurance plans.
So I know for some of the questions we defined, the terms that we defined, prior authorization, we defined step therapy. I don't know if we did some of the more kind of simple ones. And I think that's a really great point because the findings showed they don't understand it. And because they don't understand it, they're not getting the best benefit and they're not getting the right treatment. So I think, in terms of plans to develop educational programs, I think that's something that kind of falls in our wheelhouse and our Frankly Speaking About Cancer program. I know that we've also been developing some online modules to help patients kind of better understand how to understand things. So I think there's opportunity there.
Hi, Katie Winkworth-Prejner from NCCN. As you said, you have this warehouse of a lot of data. So are you going to periodically be publishing more reports as you go through the data?
Yes, so the plan is in 2017 to publish more white papers on specific topics.
I'm Joanne Buzaglo. I'm Senior Vice President of Research and Training at the Cancer Support Community. So one of the things I looked at your information about clinical pathways, right? And we just did an interesting study doing some focus groups, interviews of patients. And often they would say, yes, they think they understand what a clinical pathway is, or they even think they understand what a clinical guideline is. And when you drill down, they don't understand what it is. And so I do think it's our job. I do think this is an opportunity, as you're saying, for us to think about how we can better engage and educate patients so that they're able to ask questions to their doctor. I mean, if you don't know, you need to know that there's a question to ask, right? And I think that we can do a lot more to raise awareness and encourage people to ask questions of their doctors and their healthcare team. The doctors don't always know the answers, so but really push the system to answer their questions so they can make informed decisions.
And I think that was the one point about the decision tools. So the need for decision tools, and we have you obviously know this, Joanne, but for those who don't, our open to options treatment decision tool, which is free of charge for people, and they can call and help put together a list of questions to have conversations with their providers. And if financial issues are something that the individual is already concerned with, that's something that would bubble up onto that list of questions.